Hey there everyone. Welcome back to the channel. Today, we're diving into a super important topic, the unusual symptoms of diabetes. You probably know the usual signs, like feeling thirsty all the time or needing to use the bathroom more frequently, but what if I told you several strange, lesser-known symptoms could be signaling your blood sugar levels are out of control? Some of these might surprise you, and trust me, these are things you don't want to ignore. So grab a cup of tea, sit back, and let's dive deep into the world of hidden diabetes symptoms. We're starting with something that's not only surprising but could be sitting right in front of your mirror every morning: dark patches on your skin. I'm talking about thick, velvety patches of dark skin, usually around the neck, armpits, groin, or even your joints. This condition is called Acanthosis nigricans. Now, a lot of people brush this off as dry skin or think it's just due to sun exposure, but it's actually a big warning sign of insulin resistance, which is often a precursor to type 2 diabetes. What's happening here is that your body's insulin levels are high, and that excess insulin stimulates the growth of skin cells and melanin, causing those darkened patches. So if you've noticed any areas like this, it's definitely worth checking in with your doctor because this could be an early sign that your body is struggling to manage blood sugar. Now, let's talk about something that sounds like a dream come true: losing weight without even trying. You might think, what's the big deal? I'm dropping pounds, so things must be going great. But the truth is, if you're losing weight quickly and can't figure out why, it could actually be a red flag for diabetes, especially type 1 diabetes. When your body can't produce insulin or use it properly, it starts to break down muscle and fat for energy, and that's what leads to this sudden and unexplained weight loss. Some people with type 1 diabetes can lose as much as 10 to 15 pounds in just a couple of weeks, even if they're eating normally or even more than usual. So if you're noticing dramatic weight changes that don't add up, don't ignore it. This is a classic sign that something's not right. Let's move on to something you may have experienced before but never linked to diabetes: frequent infections. Now, I'm talking about things like skin infections, urinary tract infections, UTIs, and even yeast infections. Why does this happen? Well, when your blood sugar is consistently high, it weakens your immune system. In simple terms, your body becomes a much easier target for bacteria and fungi. It's especially common for women to notice more frequent yeast infections, and this is because yeast thrives in environments with high glucose. So if you're suddenly noticing that you're getting sick more often, or if infections just keep coming back no matter how often you treat them, it could be a sign that your blood sugar levels are out of control. Here's another sign that can fly under the radar but is extremely important: slow healing wounds. Picture this: you get a small cut or scrape, something that should heal up in a week or two, but instead, it seems to linger for much longer. Or maybe it even gets worse. Why does this happen with diabetes? It's because high blood sugar affects your circulation and damages the nerves, which slows down your body's ability to repair itself. Blood flow is crucial for healing, and when it's compromised, even the smallest wounds can turn into serious problems. So, if you've noticed cuts, scrapes, or bruises sticking around for weeks or even months, it's definitely worth getting your blood sugar checked. Another sneaky symptom to look out for is tingling or numbness in your hands and feet. This is called peripheral neuropathy, and it happens when high blood sugar damages your nerves over time. You might feel a sensation like pins and needles, or it might be a numbness that you just can't shake. At first, it might feel like no big deal. Maybe your foot fell asleep. But if it's happening often or lasting longer than normal, it's definitely something to pay attention to. Nerve damage is one of the most common complications of diabetes, and while it might start as something small, if it's left untreated, it can become debilitating. So, if you've been experiencing this weird tingling or numbness more than usual, it's time to take it seriously. If you find this video helpful and informative, please support the Healthy Pantry channel by leaving your comment below, liking this video, and subscribing for more daily health and nutrition tips. Now, let's talk about something that a lot of people don't realize is connected to diabetes: blurry vision. You probably know that high blood sugar can affect your eyes, but here's the interesting part: it can come and go. One day you're seeing things clearly, and the next it feels like your vision is all over the place. This happens because fluctuations in blood sugar levels cause fluid to move in and out of the lens of your eyes, making it harder for them to focus. And here's the kicker: if you're experiencing this, it doesn't just mean you need a new pair of glasses. It's a sign that your blood sugar levels are unstable, and that could be a big deal for your overall health. Vision problems are a common symptom of diabetes, and if you've noticed this kind of on again, off again, blurry vision, don't ignore it. What's more, this one's really fascinating and might catch you by surprise. Fruity or sweet-smelling breath. Yes, your breath can actually be a clue to your health. If your breath smells fruity, almost like you've been chewing on sugary candy or even nail polish remover, this could be a sign of diabetic ketoacidosis, DKA, a life-threatening complication of diabetes. DKA happens when your body can't use sugar for energy because there's not enough insulin, so it starts breaking down fat for fuel instead. This creates a buildup of acids called ketones, which produce that strange, fruity smell. If you notice this, it's time to take action immediately because DKA can become a medical emergency very quickly. Moreover, let's talk about something that seems innocent but could be a hidden sign of diabetes: itchy skin. And we're not just talking about a little itch here or there. This is persistent, annoying itchiness, often in the feet, lower legs, or groin area. Why does this happen? Well, diabetes can lead to dry skin, but it also increases your risk for infections, which can cause itchiness. Your body's reduced ability to fight off infections combined with poor circulation can make it harder for your skin to stay healthy, leading to constant itching. If you find yourself scratching more than usual, especially in these areas, it might be more than just dry skin. Now, here's one that often gets overlooked: mood swings and irritability. We all have our bad days, but if you find yourself snapping at people for no reason or feeling unusually down or anxious, it could be a sign that your blood sugar levels are out of whack. Why? Because your brain relies on a steady supply of glucose to function properly. When your blood sugar is too high or too low, it affects your brain's ability to regulate emotions. This can lead to feelings of anxiety, irritability, and even depression. So, if you've noticed a sudden shift in your mood or emotional stability, it might be worth considering whether diabetes could be playing a role. Cravings, especially for sugary drinks, can be another sign that something is going on with your blood sugar. Have you ever found yourself reaching for a soda or sweet tea multiple times a day, even though you know it's not great for you? That's because high blood sugar levels make you dehydrated, and your body mistakenly craves sugar instead of water. It's your body's way of screaming, "I'm thirsty." But instead of giving it more sugar, you actually need more water to help flush out the excess glucose. If you've been experiencing these strong cravings for sweetened beverages, it's time to rethink what your body really needs. But wait, there is more. This next one is a tiny but telling sign: skin tags. If you're seeing more small, soft growths on your skin, especially around areas like your neck, armpits, or even eyelids, this could be a signal of insulin resistance. Now, skin tags by themselves aren't harmful, but they are a clue that your body might not be processing insulin the way it should. Insulin resistance often comes before type 2 diabetes, so if you're noticing a sudden increase in skin tags, it could be a subtle hint from your body that your blood sugar needs attention. Did you know that hearing loss can be a symptom of diabetes? It's true. High blood sugar can damage the small blood vessels and nerves in your inner ear, leading to gradual hearing loss over time. People often miss this one because it happens slowly, and they just chalk it up to aging or noise exposure. But if you've noticed that you're asking people to repeat themselves more often, or if you're turning up the volume on your devices, it might be a good idea to get your hearing checked, especially if you have other risk factors for diabetes. Finally, let's not forget about oral health, something that's deeply connected to your overall health. If you're experiencing swollen gums, frequent gum infections, bad breath, or even loose teeth, it could be related to diabetes. High blood sugar weakens your body's ability to fight infections, and that includes your mouth. Gum disease, also known as periodontal disease, is more common in people with diabetes, and it can even make it harder to control blood sugar levels. If you've noticed an increase in dental problems, it's worth considering whether diabetes could be playing a part. Lastly, let's talk about fatigue. We all feel tired sometimes, but persistent, unexplained fatigue even after a full night's sleep, can be a major sign of diabetes. Why? Because your body isn't able to properly use glucose for energy when your blood sugar is out of balance. Essentially, your cells are starving for energy, even though there's plenty of sugar in your bloodstream. If you're feeling constantly worn out, dragging yourself through the day, and you can't explain why, it's definitely time to check your blood sugar levels. So what can you do? If you're experiencing any of these symptoms, especially if you notice more than one, make an appointment with your healthcare provider. Catching diabetes early is key to managing it and preventing serious complications down the line. If you found this video helpful, don't forget to hit that like button, subscribe to the channel, and turn on your notifications so you don't miss out on more health tips and wellness advice. Thank you for joining us here at the Healthy Pantry. We hope you found the information valuable and inspiring. Remember, your health is a journey, and we are here to guide you every step of the way. Thank you for watching, and we will see you in the next video.